For this first technique, I'm using the back of the knuckles to warm the abdominal wall, rectus abdominis, and external obliques, just to slow, firm, and deep glide in a superior direction towards the rib cage. As I get closer to the top, I will use a palm to sort of continue that into the costal margin and prepare the tissues for deeper work. For this next technique, I'm outlining some locations where we can generate some compressive edge work and get deep release on this tissue. Now, there is no bony back structure, so the experience with the client is a little bit different, so we want to make sure we move very slow, increase our pressure with the exhale, and make sure they understand how to utilize edge. And in each spot we'll hold until the edge releases and we can go deeper. Now, I'm just outlining the locations and showing you some tool options, but we can spend a good 3 to 5 minutes per spot when these are the tissues that we're drawn to release, or we feel like this is where we want to spend most of our time. I will do this along the rectus abdominis and then as well along the oblique layer. Okay, next I'm going to the outside of rectus abdominis. If you can't find the outside easily, just have them lift their head off the table. You'll feel rectus abdominis fire. You want to be right at the edges. I'm sinking my knuckles in, and I am attempting to, in that first one, get in there with fingertips. Here I'm using an overgrip, and I'm just compressing rectus abdominis and squeezing. You can also generate a sensation of lift here as well, but for the most part, we're just looking at an alternative way to create compressive force. I'm going to do the same thing out here with the oblique tissues. I think I'm going to drop them so you can see that I actually do have obliques here. So we can see right there, if you watch between my grip, the obliques will fall right there. And one more time, they will fall right there. Yep, so I've got them in my grip, and I can compress and release them with the pincer compression. Next, we simply have a series of glides, one along the rectus abdominis belly, and the second will be along the obliques. So this one will travel pretty much just outside of the belly button, all the way up to the costal margin, and the second one will travel slightly lateral into the obliques. The oblique glides can be slightly angled depending on your intention with the technique, but as long as you're giving some directional influence in a superior direction with a precise tool. In this next technique, we're going for both iliacus and psoas. You see me just outline the iliac crest there and then find the asius. So you also see that the hip is in flexion, so foot to the table, knee up. And there's that little valley there right in front of the asius. So sink into that valley, and right in front of your finger pad, so towards you, is going to be iliacus. You can have them resist hip flexion, so resist them bringing their knee up towards the chest, and you'll feel it fire. Hold compressions. Glides and frictions are on a case-by-case basis, as that's going to be pretty intense. And then if we want to hit psoas, we simply just adjust. You'll see in a second I'll adjust my fingertips more towards the lumbar vertebrae, and then there'll be a couple of sections from the lower to the upper portion of the lumbar spine that we can isolate this muscle. In this technique, we're just warming the pectoralis region for preparation to get into the deeper fibers of the muscle. There's a couple options here. I'm starting with a palm from the sternum out towards the shoulder. This is a great way to introduce touch, especially if working on a female client. This is a pretty safe approach. Another that I really enjoy is a more pin and stretch style, which is to bring the palm into the same region towards the sternum, and then you have a couple movement options here. Abduction, external rotation are the two primaries to pin and stretch the pectoralis major. Next, we're going to focus on the sternal and costal heads of the pectoralis major, applying frictions along the sternum just slightly to the side of the pec that we're treating. So this is right at the costosternal junction, right where the ribs meet the sternum. This can be a more sensitive area than you might think. So tread with caution, very, very lightly. Thumbs are an option, and also fingertips in order to avoid the emergence of breast tissue. In this next technique, we're utilizing a pincer compression to grab the fibers of the pectoralis major and squeeze utilizing edge technique. This is a purely compressional technique, so we're not gliding, we're not moving. We could technically apply some pickup compressions here, but for the most part, we're looking to get some deep releases into the large fibers of the pectoralis major. Okay, so we've warmed the area, we've applied some frictions and compressions, and now we're going to glide along the fibers. I am choosing to glide towards the shoulder. Either direction works fine. Positionally, you just want to make sure that you're getting a good depth, getting some precision in the fibers, and hopefully getting some additional freedom in this area. Again, most people suffer from rounded shoulders, so anything to start promoting a more open and free shoulder girdle and shoulder joint is a positive. There will be three lines that we approach here. One along the clavicle, a second that's sort of midline of the belly, and then a third, which will be pretty lateral, along what I would consider to be the lateral fibers of the pec major. Okay, next we have our one technique for subclavius, which will be treating right underneath the clavicle. I have a knuckle here, so I'm going, if you can imagine, into the body and then hooking up into the subclavicular space. I really like a knuckle here as the space fits well, but watch again as I go down and then hook up. You can see the angle of my wrist changes as I sweep up towards the underneath of the clavicle, which is something you really have to do to get to this muscle. So as you don't get fooled by thinking you're on the pec major, here is a fingertip variation as well. Okay, next we're going to go into find the pec major. I like to create a little bit of space here, but not have the arm all the way above and overhead because you don't want to put length and stress on that pec major because see, we're going to move it out of the way. So fingertips come in to find the rib cage. We're going to lift. You can see where I'm pointing to pec major, lifting up and off the body. And I'm sneaking underneath the pec major to find that pec minor. This is a really tough one, guys. It's hard to really confirm you're on there. You can strum. So once you're here, you want to hook down into the ribs and strum back and forth to make sure that you're on the fibers. You can have them take a deep inhalation that might elicit movement in the muscle, or roll their shoulder blade back and down would be a way to do it. But you just want to sit and apply some direct compressions to the belly of pec minor. All right, serratus anterior, we're going to apply some warming techniques along serratus anterior. I'm sort of outlining the attachments on the upper 9 ribs. I'm sitting and leaning my body against the lumbar spine so that I can open this area up so I get a nice stretch through the torso and a nice warming application into the belly of serratus anterior, right around the inferior angle of the scapula. Here I'm moving to the front of the body to show you the variation from the front. You'll have to bring that second hand around to the back of the shoulder blade to stabilize it. Same idea. You might get a little more rotation out of this approach. As best as you can, you want to outline individual ribs as they make their way up. And I like to go in and sort of glide a little bit and compress with thumbs. You can get a little bit of movement back towards that spine, but for the most part, we're just looking for really tense spots along that rib cage to do some edge releases and get some freedom into that space. Remember, this is a big breathing muscle, so having them breathe at the same time. Now I'm working up towards the upper ribs, but think about each individual ribs as they relate to the scapula and detecting if there's any tension along those ribs. Where this muscle belly lies. If you've ever eaten a rack of ribs, I know this is kind of gross to some people, but that's the muscle we're treating right here, serratus anterior. So try to find each individual section and treat it for tension and adhesions. Finally, we're going to try to make it towards that attachment on the vertebral border of the scapula. I'm using a thumb here and stabilizing the scapula, gliding in with the thumb as deep as I can get. And I'm going to integrate some passive range of motion, upward and downward rotation, retraction and protraction, as I look for points where serratus anterior is sticking to subscapularis.